practiced on my own for a year, but in practice for 7 years prior to that doing headache. But unlike many traditional physicians, I do see a very large role for complementary and alternative treatments. Although I don't do acupuncture, for instance, I have many patients who get acupuncture and get significant relief from it. My overall kind of mantra is, if it makes you feel better, then it's good. So if I can't explain what the underlying physiology is, why acupuncture might work, or why the pills in your bottle might work, it's okay. If you're feeling better and your headaches are reduced, then great. I'm really happy about that. That's my goal as a doctor, is to get you feeling better, right? I was very interested in your in the oils, because there is some evidence that some essential oils, and specifically peppermint, can help relieve migraine. And it's only a small study, but there is one study that actually shows that peppermint oil has a muscle relaxing effects as well as an analgesic effect, and a calming effect. So those are all three things that would come in very handy during a migraine.
Where do you have specific places that you put it?
So when I get a headache, the temple, and it's because I use very pure therapeutic grade, you just need a drop.
Tiny bit.
Where do you buy it?
I actually distribute it, but I started distributing after I started using it. So I went to an aromatherapy party and I was introduced to it. And when I showed up, the first thing was my feet were really swollen because I had a bunion surgery. And so she started with the lavender and everything. And I had a headache because I got lost for 2 hours. So when I came and she just used different oils on me, I'm like, man, this stuff really works. So I started using it on my own. I don't really sort of work the business side of it. I mostly use it for my family. And so I use the peppermint, 1 drop, and I apply it to the temples, here, and the back of the neck. And it relieves head pressure.
Good.
I don't know why, but hey, it works.
So there's a lot of things as a person who has headaches. There are some really important things you can do to get control over your headaches. Number one is knowing yourself, right? Knowing what your lifestyle and behavioral choices are that you're making, that number one may be contributing to your headaches, or actually maybe keeping you healthier from getting even more headaches. And number two is knowing your headaches. Both the different headache patterns you may have, what triggers, and I'll talk about that in a minute, as well as really what kind of headaches you have. Self-misdiagnosis is a tremendous problem in migraine headaches. More than 50% of migraineurs are not diagnosed in the United States. And the reason why is because, well, number one, we haven't done a good enough job of educating people about this. Doctors haven't done a good enough job of diagnosing their patients with migraine. And patients often don't go get help. They go, oh, it's a sinus headache. Or, oh, it's from my allergies, which allergies certainly can trigger headaches. And so they accept that this is their lot in life. You know, their mother had it, and their daughters have it, and their sisters all had it, and they put a wet rag on their forehead and take their Excedrin, and it'll go away in 2 days. You know, and so unfortunately, we still have 50% of migraineurs that are undiagnosed. Making the diagnosis of migraine versus tension headache versus cervicogenic headaches or cluster headaches. Cluster is actually usually on the easier side to diagnose because they're very unique. But, a lot of these headaches have overlapping features. One of the slides I was going to show you is the diagnostic criteria from the International Headache Society. They're the ones who set out all the specific details of how you make this diagnosis. And if you look at the diagnostic criteria for migraine and for tension type headache, it's like one of those, that joke with the Chinese menu, right? 2 from column A, 1 from column B. And what you see is a lot of the features can actually be mixed from the 2 different kinds of headache disorders. Now, yes, we see a good amount of patients who have just clear-cut migraine, but a lot of patients don't fit textbook, and they do have features of other ones. So getting the right diagnosis is really, really, really important. The next thing, one of the next major pieces that you need to accomplish is finding the right doctor. And that doesn't necessarily mean just one doctor, but you need to find the right doctors. If your doctor is shying you and saying, here, take this and get out of my office, or just take some Advil, don't worry about it, and doesn't ask you any questions and doesn't engage with you on this as a real issue, then it's probably not the right doctor for you. Also, if your doctor is out of options, they say, well, I don't have anything else,
Wow.
then you need to find a new doctor.
That's why that's my doctor.
Because there are options, and I actually have a couple of people that I told that to. But I also told them, I want you to go see somebody else, because I'm experienced and I'm out of options. So I'd like you to see somebody else who maybe they can think of something that I haven't, or see something differently than what I've seen. So you have to find the right doctor. And you have to be engaged in your own health care, which is kind of important for the article that you're writing. I think getting rid of headaches, or you never really get rid of them, but treating headaches is something that both the patient and the doctor have to be really engaged in that process. I can't, for most people, for some people, they're easy migraineurs, I can give them a prescription for Imitrex, and they'll take it twice a year, it gets rid of their headaches, and everything's fine. But that's the exception.
Can I ask you, why is it that, so like when you get migraines, like when I was diagnosed before, they gave me these caffeine tablets. But then I heard that caffeine can actually cause a migraine. So why would you give something that...
So caffeine is an interesting chemical. Caffeine, we know, acts on certain neurotransmitters in the brain. We know that caffeine can abort a migraine. So a lot of people, for instance, who haven't seen a doctor will say they take Tylenol and drink a Coke. And the Coke is not for the sugar, but it's for the caffeine. Caffeine works. Caffeine is a brilliant migraine reliever. The problem is that when you take it every day, it causes migraines. So I have, I know some people who don't drink coffee, they don't drink tea, they don't eat tons of chocolate every day, and so they don't have caffeine in their system all the time. So twice a month when they have a headache, caffeine works really nicely. But when you take too much of it, it loses that effect, and then, in fact, it can cause headaches. So we'll talk about migraines because that's the most. And everybody here has migraines. Well, I mean, the headache sufferers. All of their family members have migraine, and smells gets them. Well, smells don't do it for attention headache sufferers. That's a migraine thing. So even that's not in the diagnostic criteria. With enough experience seeing migraine patients, you get to a feel of how to really parse out who's really having migraine, who's really having tension type headache, who's really having sinus. Sinus headaches are very uncommon, to be perfectly honest. Most people who think they're having sinus headaches are having migraines. It's the number one misdiagnosis in migraine, and it's misdiagnosed because the nerves that sense and are one of the central parts of migraine, are the trigeminal nerves, also at one point carry the autonomic nerves to the membranes in the sinuses. And so they stimulate those membranes, there's swelling and edema, and that causes this pressure sensation. So if you have a mild headache that's behind your eyes, and you've got all this pressure here, and maybe you've got a little tearing, or something like that, but there's no sinus infection. There's no, they can do 100 CAT scans on your sinuses and never find anything and treat you with all the antibiotics, and this headache isn't going away. It's because it's not.
This treatment is coming from the brain, is it? Because, that's funny you should say that. My mother, for like 10 years, she was misdiagnosed with sinus headache. She swore it was sinus. It was a brain tumor. She had
so people, right. Well, I'm sorry to hear that, and I hope she
did okay. No,
she's
fine.
Good.
It wasn't cancer, though. It was
right.
meningioma. But it's interesting.
So, so we see it more, in fact, on that side, that people are told that they have something like tension-type headache, and it's really migraine. And they're missing out on a lot of migraine treatments that way, which is a shame. So you got to get to the right doctor. Secondary headaches, I just put that here because that's what you asked before. How do you make the diagnosis? You make sure there isn't something else causing the headache. If it's a tumor, that's a secondary headache. So that's in that category of headaches that are caused by other stuff or secondary headaches.
But you got to tell me, what is the sex headache? I got to know. I got to know that.
So those are, we're going to spend the whole time talking about this. So those, there are actually different points during intercourse, or not even